if you actually think of a healthcare system as not being a physical location, to me, that's kind of the vision I have in my mind. It's basically wherever the person is, that's where healthcare should be. And it should be anywhere, anytime. It should be in a way that really fits into their lives very nicely. And by the way, that doesn't mean that I'm kind of suggesting that people need to get up at 3 o'clock in the morning because that's convenient for for their client or their patient. But it's more about using the tech then to actually be able to bridge those gaps and divides where it's very hard to have a physical person in anywhere, anytime. Because we need to sleep, we need to eat, we've got, families and social life. So that's not pragmatic, but through digital health and using different types of tools and methodologies and sort of figuring out how to actually build out the service, for lack of a better term, so that it does wrap around the individual wherever they so choose to be, and be able to gain access to content, gain access to support, gain access to the healthcare practitioners, in a way that actually really works for their existence and their life and their sort of goals that they've actually set for themselves. That to me is something we could all learn from, not just be inspired by disability, but actually be able to do it right across the healthcare spectrum. What are your thoughts?
That's right. Another point that you raise is really good about the technology, and I'm sure this is something in your experience, being on the frontier of health tech, is that the technology is something that puts a lot of people off. Because there's a fear around getting the technology wrong, not being able to use it, not being able to troubleshoot. And we get that a little bit in the recruitment phase when we talk to clinicians, that often is a place of anxiety. What we reinforce with them is that technology is the avenue. It's not the be-all and end-all. It's certainly not the centerpiece. It's how you approach the client as a clinician, what your values are, what your mindset's like. Are you showing that empathy and compassion that I've mentioned a few times? And that sometimes technology will fail. And for us, what we do, and particularly in rural communities, of course, is we pick up the phone and we talk to them on the phone, because to some people's surprise, phones can still make phone calls. And this, having this backup doesn't require that pressure to be on the technology to work all the time.
Yep. Well, that's great. So a backup, really important in the telehealth kind of model. I think that's a very wise point. Tech will fail. It's man-made, so it will also never be perfect. Something will always go wrong with it. And that's not a great experience for somebody who's thinking, where's my healthcare practitioner? Right. They're supposed to be here. It's almost akin to somebody walking into your clinic and there's no one there. It's not a great experience. So that's a good tip. Any other tips that have kind of come through in the Umbo experience that you think, what are your top 3 perhaps? So we're talking backup on video.
So this is in terms of for healthcare providers?
Yeah.
So I think having a backup is really important. I think another thing is really about trying to sit with the client and really understand from their point of view why they think this is the right way to go, because you can have a whole set of assumptions about what you think it might be, but not really be clear as to what it is for each individual person. And probably the third tip is to think big. We have a lot of conversations with people where they say something along the lines of, X percentage of our clients are quite happy with face-to-face, so why would we need to do anything online? And our point is, well, that's X percentage of your current existing client load. What about that Y number of clients that are sitting outside that client load? And what about your duty of care towards perhaps people that are not in your geographical area, regional, rural Australia? So to me, being able to do telehealth and being able to do it online is really about expanding your horizons, and there's no better time to start than the present.
Totally agree. Although I'm a bit of a groupie of the teleworking type model from, probably the last 25 years of, my working life. And it's so much better today in the tech, but I agree with you. Tech is not in of itself the answer. In digital health terms, and particularly around innovation in digital health terms, there are 3 key things that I think need to come together. You've used one of the terms, mindset. If you think you can, you can. If you think you can't, you can't. Either way, you're right. So you've got to have the mindset built around iterating and being able to take, perhaps I call it R&D, research and development. It's kind of, okay, so let's say our business of healthcare is, everything's fine, it's all good, it's under control. So if it's not broken, it doesn't need fixing. That could be a very normal mindset for a lot of people. But inevitably what will happen is somebody in the industry is going to push a frontier. They're going to find some new way of doing things. And slowly but surely that will start to become the prevailing, way of doing things. So I think everybody should have a little bit of R&D in them, where they're sort of, testing the waters with some clients around ways that are, might sound like a good idea, and make sure that the client is actually feeding back and agreeing that it is a good idea. So the mindset's really key. The other side, I do think tech is useful to combine with the mindset, but in of itself, it needs the third part, and the third part is culture, and that's basically making sure that the whole team and the leadership and everybody is coming along for the ride. Otherwise, we're just subscribing to tools, but we're not getting productivity gains out of them because we haven't actually fully embraced them. We haven't implemented them at a cultural level within our organization. Or conversely, our culture hasn't changed, and so the actual tools just reflect the way things are, not the way that where they should be. Have you? Does that resonate with you? As a business owner in healthcare? Yeah.
I mean, we've had conversations with investors and foundations, and that question about defensibility. So the question is usually something along the lines of, what is it about your model or your business or your organization that is better than the others, really? And my answer always comes back to culture. We have this really incredible culture at Umbo where we do use that mindset of empathy and compassion internally, externally, in everything that we do. And it's borne out in every interaction. And that's one of the key reasons why I think it's working for us. I also remember this study that I looked at. It was on Harvard Business Review, and they surveyed the top 500 CEOs, I think Fortune 500 in the States. And they asked them, what is your job as a CEO? And there's a lot of variation, of course, but the number one answer, 92% of CEOs said, my job is to set and maintain culture. And I thought that was really interesting. Like, out of all the things that a CEO could do, that is the number one thing that they thought they should do. Without that culture, you can't really do anything. If the culture is broken, it doesn't matter how great your product is, how great your technology is, how great your marketing, your social media is. It just doesn't work.
Totally agree.